Okay, on to my second part of the video here. I'm going to inspect his mouth, his pharynx, his tongue. Open up. I'm going to look inside, check his oral mucosa, looking for any bleeding of the gums, any lesions on his tongue, any sores in his mouth. I'll ask him about his dental care, how he takes care of his teeth, just doing a little general assessment there. Then I'm also then I'll ask him to open up and say ah. Hold down his tongue with the tongue dispenser, check his gag reflex, and things like that. I'm going to come in here, I'm going to check his neck, I'm going to feel along here for any masses. Can I have you swallow? Okay. Looking for any scars, any marks on his neck, any place that's tender when I touch it. The next thing I'm going to do is check his lymph nodes. I'm going to start with the lymph nodes up here, move to the axillary ones, and then I'm going to check his lower lymph nodes in his groin area, checking for masses as I go along. His upper extremities, I'm going to check his, can you raise your arms for me? You put your arms out to the side, checking for range of motion. Can you turn them like this? Okay, everything looks good. I'm just going to take a look here. Look for any scars or sores. Turn it. Okay, can I get you just to squeeze my hands? Alright. Okay, then I'm going to do his lung assessment. I'm going to listen to his lungs in the 6 areas with his shirt off and my stethoscope. Listening for breath sounds, listening for anything that might show up there. I'm going to also watch as he's lying or standing, just the rise and fall of his chest for asymmetry and that type of thing. And then I'm going to go on and check his cardiovascular, so I'm going to check for a radial pulse. I'm going to count that out for a minute. I'm going to check for his carotid pulse. Okay, and I'll listen to his apical heart rate. Listen to the 4 chambers of his heart. See if I can hear any murmurs or anything like that as it's working. Checking for cap refills again in his lower extremities. Also, pedal pulses, things of that nature, to make sure all that's working appropriately. And then, the next thing is my breast exam, which I'm not going to do today. And then I'm going to move on to the abdomen, palpate for any masses, tenderness. I'm going to feel out the different, the liver and the spleen and all those things with my hands. I'll also have him sit forward, and I can listen for the difference in for my area where my liver is. I'll auscultate, listen to the 4 quadrants of the bowel, listen for sounds, make sure those are working appropriately. And then I'm going to move on to his lower extremities. I'll check his legs, look for scars, look for scratches, bruises, question anything that I see. Can you lift your legs? Okay, can you bend your legs? I'll have him. I can see that he has full range of motion. I'll have you stand up. Okay, and sit back down. Okay. That's the end of my second video.